Good. See your screen.
And is everybody on?
So we've just broadcasted. They should start flowing in.
Okay. So
You'll see them coming in now.
tell me when to go. Oops.
We have about 7 people in. I'm not sure if you want to get started.
Okay. Hi, everybody. Welcome. I'm Jeff Dennis. I'm the chair of TiEQuest 2020. We've got a great night planned for you this evening. We've got 4 companies that will be pitching. And I've got a little brief presentation to tell you a little bit about TI and what these companies have been through to get here. But basically, you know, TiEQuest is an annual pitch competition. We usually start and do it live, but because of the COVID crisis, we've had to change course. And so here we are online. And what we're doing is for the next 3 nights, and then on Monday, we're going to complete the preliminary round where we're having 25 companies pitch 5 a night over the 5 evenings, and 1 winner will come out, and the 5 finalists will be the winners from each of these evenings. We'll pitch on June 29th for the Grand Championship. As I said, I'm Jeff Dennis. I'm the entrepreneur in residence at Fasken, and I've been the chair of TiEQuest for a few years. This is really my passion project, and our goal with TiEQuest is to help these companies, showcase them, and in many ways being online is better than you know, in my office in a little boardroom with 4 or 5 judges. We now have the opportunity to share these stories with many more people. And we're very grateful for our sponsors. The Royal Bank has been a sponsor for many, many years. They're our presenting sponsor. And they stood by us during the COVID crisis as we tried to figure out how to come back and reinvent ourselves, as so many other businesses have had to do. And we are very appreciative of BDO, Fasken, my firm, the City of Toronto, Air Canada, Baylis Medical, the Biz Planner, and First Angel Capital. Without them, we just couldn't do this. The winner wouldn't have a prize. And so we're very grateful. You know, TI is a global organization. It's a nonprofit that focuses on helping entrepreneurs. There's 61 chapters in over 18 countries. There's 15,000 members. We've helped over 10,000 startups. In Toronto, our mission is to foster entrepreneurship and to encourage and nurture the next generation of entrepreneurs. We focus on education, mentoring, networking, funding. Basically, we give back. And TiEQuest is our major project every year. It's our showcase event. It's a multi-stage business competition for early stage, mostly tech companies in various verticals and industries. We usually get 100 companies, and they go through a 4-stage process, and ultimately we end up with a winner. We've touched many companies over the years. Last year's winner was Genesis. They're a company that does, they turn plastic, they use a plastic that's biodegradable, so it solves the you know, the packaging problem that we face. They've raised $4.5 million since TiEQuest last year. They've solidified important partnerships, have started building their demonstration plant, and so TI really helped them along the way. Over the years, we've had many other success stories, and tonight and through the rest of this process, we hope to add a new logo to our board here. But you may be familiar with some of these companies, and they've all done well here, but they've gone on to do well as well. So here's where we are in the process. We started back in December opening up applications. At the end of January, we closed applications. As I said, we had about 100. We completed an online judging process where the 100 were reduced down to the top 50. And then we had a mentoring workshop for them to help them along the way. And on Saturday, March 7th, we had live pitches at my office where the 50 companies pitched, and the 25 that you're going to see some of tonight advanced to this round. So what's going to happen, as I said, last night we had a group. Tonight we're having a group, and we're going to do this every night till Thursday this week, and then Monday next week with a finals on June 29th. The way it works is there's a scoring sheet, and our judges are asked to complete a scoring sheet. Each company will have 10 minutes to present. There'll be 10 minutes of Q&A, and then there'll be 5 minutes in between where the judges can deliberate a little bit, fill out their scorecards, do what they have to do, and then we will then watch the presentation of the next company. We're going to repeat that over the course of the evening. When the judges are making their assessments of the companies, this is the criteria that they use, and we try to look at the key drivers of success. You know, is there a value proposition? Do they have traction? Is this viable? What's their team look like? Who's the competition, etc. This all will culminate on June 29th at 7 p.m. It's free. Please go to the link on the slide here and register. We hope to get as many people out to see the final 5 pitch and see who the ultimate winner that will get the $25,000 prize. We're very fortunate to have some great judges tonight. We have Kumar Stengar, who's a angel investor and serial entrepreneur. We have Mo Kirpalani, also a serial entrepreneur. Linda Montgomery, who's very active in the Toronto ecosystem for entrepreneurs and for startups. Hazem El Ali is with the Royal Bank, our sponsor, and Savash Zabolian is a serial entrepreneur with does a lot of work with and mentors many entrepreneurs. So that's it. I'm going to stop sharing my screen. We're going to invite our first contestant in, and let's see who that is.
Sean from Minutebox is on. So Sean, if you want to share your screen, please do so now.
So hi, Sean. You're going to have 10 minutes to do your pitch, and then there'll be 10 minutes of Q&A. I'll probably rudely interrupt you at the 10-minute mark. So, you know, you're a big boy. You can take it. And whenever you're ready and your screen has been shared, go ahead.
Certainly. Thank you, everyone. Just give me a moment and I'll share my screen here. Okay. Everyone can see my screen now?
Yes.
Good evening, everyone. My name is Sean Bernstein, and I'm a co-founder of Minutebox. And Minutebox deals in the world of corporate minute books. If ever you've been an entrepreneur, if ever you've been a business, or if you're like myself, as a former corporate lawyer, I was surrounded by nothing but physical binders sitting throughout the law firm. A minute book is a collection of simple but necessary company records, everything from articles of incorporation, company bylaws, share certificates, etc. And for the most part, this information is stored in a binder sitting on either a law firm shelf, perhaps the shelf of an accounting firm, or sometimes large organizations manage this information on its own. But oftentimes this is what it looks like. This is an actual Minutebox client, a law firm here in Toronto. In the basement, you can see dozens upon dozens of minute books strewn across the basement floor in a system that is both quote unquote totally waterproof, and an interface for a piece of software that they have, which looks like it was built on Windows 95. This is the truth when it comes to corporate minute books in today's day and age. We're still in a world of physical minute books, physical information, inability to see things when we need to. The solutions that law firms, accounting firms, and major corporations are using when it comes to the storage and maintenance of their corporate minute books is often on-premise, on-site storage solutions. Many of these technologies are difficult to use, they're cumbersome, they have a limited number of licenses, which result in team members sharing passwords and creating an inherently insecure environment. This is where Minutebox differs. Rather than physical, we believe entirely in a digital world. Rather than having software stored on site, we believe everything should be cloud-based, accessible from home, office, or even on vacation, which some lawyers tend to do from time to time. Whatever software that's introduced should be simple, easy, fun, and intuitive to use with an unlimited number of licenses, and everything should be built with a security-first focus. This is what we've built at MinutBox. There are three fundamental pillars to the MinutBox solution. The first being the storage. That is to say, a central repository where law firms can keep digitized versions of the entirety of their minute book collection. The second component is a database, the ability to see important information that's related to the entity itself. If, for example, you need to find information about shareholders, directors, officers, etc., traditionally you'd have to go find this information within the minute book itself. Now simply look at the database, the online registers, saving everyone time, energy, and money. And finally, the ability to do what we call management or document generation. That is to say, with a simple click of a button, enable law firms, accounting firms, and major organizations to generate new, consistent documents with a simple click of a button, based off of the data that's already stored on the system. MinutBox follows a two-tier revenue system. The first being a B2B SaaS model, which combines a fixed fee for minute book scanning if needed. All of the fees that we normally charge on a per entity basis, our clients being the law firm, are then dispersed directly to their clients, resulting in a zero net cost to a law firm over the course of a given year. If in certain cases, a law firm doesn't have digital information, that is to say they require the digitization of their corporate minute book collection, we supply teams and resources in order to digitize the entirety of their minute book library. What we found in so doing over the last number of years is that this helps create a very strong relationship between MinutBox and the law firm moving forward. There are three value-added features to the MinutBox platform. The first is that it saves time. Oftentimes, a lot of the inefficiencies associated with minute book work involve simply finding the information you need, finding the book, realizing that resolutions are in someone's inbox or underneath someone's desk. This is often unrecoverable or unbillable time that, as a result, does not yield any revenues. The second one should be pretty straightforward. The fact that having information on a digital system is much better than actually having physical space reserved for minute books. In fact, just last week, I was on with a firm in Vancouver that is so desperate to use a new digital system that the structure of the building that they're hosting their minute book collection is actually compromised under the weight of all of their binders. But the final and perhaps most important value added is that proper minute book management and maintenance could be an increasingly large source of revenue for law firms of all sizes. In our research, we uncovered that on average, a law firm only updates approximately 30% of the minute books that they're storing. For every 1,000 minute books they have, only 300 get updated annually, meaning they are leaving an unrealized significant amount of revenue on their shelves year over year. And the reality is if they tried to introduce a way to scale up now, absent new technology, the only way they would be able to do that would be by hiring additional staff. What MinutBox allows law firms to do is realize on those thereby unrealized revenues at this point without the need for additional staff moving forward. Here's just a small sample of some of the current MinutBox clients, everything from one of the world's largest sporting good companies to one of the world's largest accounting firms, one of Ontario's leading law firms, as well as one of Canada's top entertainment firms, as well as many others that are slowly coming to fruition and converting from pilot over to paid clients. Here are a few metrics. We currently have 37 paying clients using the MinutBox platform, numbering over 4,000 active entities with an MRR of approximately $7,500, giving us a runway just under 15 months. Where do we find our customers? Well, there are 5 sources. The first is to create thought leadership, everything from blog posts, LinkedIn posts, both attending conferences, hosting panels, etc., all with the ability of increasing our profile in the legal innovation community, not just in Canada, but globally. In that vein, we created what we call the Legal Innovation Council, which to its name is a collection of forward-thinking legal innovators who bring all sorts of amazing ideas worldwide to a central media. And as a result, we have everything from podcasts, 5 connections, and really just opportunities to connect and share ideas on a global scale. Of course, we have cold outreach, everything from phone and email, traditional correspondences, inbound leads. We have a very strong SEO system optimized through our social media presence as well. And finally, sharing. Whenever a law firm traditionally needs to share a minute book externally, that is to say with another law firm, often in the case of a transaction, what MinuteBox allows its users to do is share that information on the platform, which means another law firm will get access, albeit read-only, to the MinuteBox platform. And that in turn has led to quite a few inbound leads. These are just some projections, and I can tell you both in the short term and long term, we plan on not only seeing, or I should say, meeting these expectations, but we're on pace to exceed them as well. Something changed not too long ago, and it shouldn't be any surprise that what has happened to the legal industry has gone from the boardroom to something like this. More and more of our law firm clients who traditionally had offices in domiciled locations are now forced to work from home, many of them without the ability to access their corporate information. Recognizing that there was an opportunity for us to help our lawyers in this community, we created what we call the MinuteBox Relief Program. This is for any law firm that is using a pre-existing solution and is unable to get their legacy data off, forcing them in turn to actually go into the office just to see their corporate minute books with free migration from whatever system they have onto MinuteBox. And if they have the, or I should say, if they don't have the ability to pay because cash is strapped for everybody at this point, there's a no risk obligation. We hope to convert these clients. We now have 8 clients with an additional 3,000 entities by the end of 2020. And we're very optimistic about the opportunity to deal with these clients and others in the future. What gets me excited about the global industry and particularly about the opportunity around entity management is just its size. The global legal industry represents about $750 billion annually, with approximately a quarter of that dealing with transactions, M&As, all kinds of different financings, etc. But we realize here that the market in relation to something as nuanced as entity management is in fact global and not regional. Just last week, I was on the line with a firm from Spain, Australia, New Zealand, Hong Kong, Singapore, and the UK, all facing the same problems that we're dealing with here in North America. This is what the competitive landscape looks like. Everything to the left of the enterprise consumer line is a traditional legacy system. That is to say, contains all the features of an older system you may have seen that I showed on one of my previous slides that was probably built on MS-DOS. These are the on-premise older solutions which are unable to deal with some of the current methods that law firms are using to manage corporate minute books.
Sean, I hate to interrupt, but we're at 10 minutes, so I'm going to ask you to stop there and
of course,
turn it over to our judges.
Certainly.
Who wants to go first? Don't be shy.
I'm happy to start us off here.
Oh, thanks, Snida.
So Sean, great. Thanks for the presentation. I know we kind of cut off a little early there. The question I have is around the economics around the savings to the customer. So does MinuteBox help them save time or save costs? And what are the quantitative stats there of the impact of having MinuteBox?
It's a great question. So the short answer is that MinuteBox helped them save both. For law firms, accounting firms, etc., the metric often is time is money. So on the time-saving metric, everything from trying to find basic pieces of information, which when you're rummaging through a sea of minute books of 10,000 plus, can take anywhere from an hour to several hours. I've worked on very large deals which were shut down for several weeks because a minute book couldn't be located. A minute book, I should say, couldn't be located. But that's just an isolated incident. So on occasion, you may have a lawyer looking for a minute book or documents, and it may take them a half hour or 40 minutes. That in itself, if you calculate based on a lawyer's time, is anything from $300 to $600 of potentially missed revenue that they could have spent doing something that's ultimately more value added. So we're reducing a lot of the inefficiencies when it comes to the general management of corporate minute books. At the same time, with the production of new documents, what used to take, you know, a couple hours to do a transaction on the document side, you know, producing 6, 7, 8, albeit routine documents, can now be reduced to just a few minutes. And this can be multiplied based on the number of minute books that a law firm or accounting firm can manage. So if you have a single binder and the argument is, well, I can do some of this stuff myself because I have just one binder, the argument is a valid one. But when we're talking about scale, that is to say, large organizations that have massive collections, they don't have the ability at all to reduce any of these inefficiencies absent the introduction of a new solution.
Right. Can I go next? Jeff, can I? Oh, go ahead, please. Thanks for your presentation. A couple of questions. One, could you explain about your management team expertise, as well as if there's any IPs around your technology?
Certainly. So if I may just, there are 3 pieces that make MinuteBox. I'll answer the second question if I may first, Salvash. The first is the 3 advantages of MinuteBox, that we can, I should say, import and migrate data from pre-existing legacy solutions that most of our competitors cannot. The second component is our security system, built from the ground up by some of the world's leading cybersecurity experts who are our leading engineers working at MinuteBox. And the final component is what we refer to as document coding. If you look at some of the other solutions out there, this is the kind of language that's necessary in order to produce repeatable documents in a very complex way. What MinuteBox has introduced with its solution is simple coding. A simple click of a button to create fields with the ability to produce whatever kind of document a user may want. So this reduces the bottleneck of going to a third party in order to produce these documents and ensures the responsibility and the power remains with the law firm or the user. Now, to your original question, this is our founding team. Each one themselves a lawyer coming from different legal practices. Myself as a former corporate lawyer, we've got family litigation as well. But not only that, our team brings something unique as each individual comes from a different expertise. Everything from financial background to one of our co-founders used to teach web design and designed our entire website internally. 2 of our co-founders themselves have brought legal technology to market. Our engineering team is composed of 2 of the world's leading cybersecurity experts who used to code for NASA and the NSA, one of which he himself is a lawyer, understanding the complexity both of the legal team as well as what it takes to build a leading piece of legal technology today.
Sean, just quick question on this time, and you talked about time. What kind of charges the lawyers charge to keep the minutes, and how is your program make them efficient to save money?
So the first, there are a number of components, and if I can break that down, Kumar. So the first is saving money comes in a number of different ways. The first is look at all of the firms on Bay Street, and I know plenty of them that can have half a floor filled with nothing but binders. Right. Imagine what the rent is to store just a plethora of minute book information. That's one component. The second component is digitizing it doesn't actually solve the problem. It's making the data useful. Traditionally, this falls under the category of what we call commoditized legal work, which means if I go through a minute book and I'm inefficient and it takes me 10 hours to do something that normally it takes me a half hour, I no longer have the ability to go out and tell my client, you're going to pay me now for 10 hours worth of work. Because not only are they well within their right, but they're incredibly seasoned and knowledgeable now to say, no, this shouldn't take you very long at all. At most, it'll be a couple $100 worth of work in terms of time spent on your end. That's all I'm going to pay. Which means if it takes you 10 hours to do something that should take you a half hour, and I've seen it time and again, you're not going to be able to recover that cost whatsoever. So at the outset, when it comes to minute book management for the law firm, accounting firm, et cetera, for them, it's about reducing internal inefficiencies. However, as I've shown, there's the opportunity to turn this into a massive, consistent, repeated revenue generating source. Because if they're only updating 30% of the books they're storing, with the right tool, they can double, if not triple that number year over year, resulting in consistent, easy revenues, again, for documents and work that can be generated with just a click of a button. So what's being presented here is not just a technology that will solve everything. Instead, it's an idea to change a process internally within a law firm to recognize that they've been sitting on a pot of gold throughout, while at the same time being able to provide value to their clients, because now the clients no longer have to call the law firm to ask to see their minute book, which happens, frequently, infrequently, depending on the interaction. Now they'll have perpetual access to their cloud-based corporate information, and is a great way for law firms and clients to collaborate in terms of the content that's under management.
Zavash?
I may
Sean?
ask one more question about your approach to converting the existing legal firms that don't necessarily have this as an issue. So for them, it's just like, added time to, switch to a new platform. It could be easier and better for them. But if you can explain a little bit about your, market strategy as well. So.
Sure. So MinuteBox is in a unique position in that a lot of our founding members come from different legal backgrounds, and we recognize a lot of the pain points that are associated with different verticals in the legal space. Initially, we decided to focus on corporate minute books for a number of reasons. One, it's a universal pain point that's easy to understand, but the problem in terms of solving it is both complex and robust. So if we can provide a solution that can permeate throughout the market globally, there's a near infinite return on just that single vertical. But at the same time, we've developed this technology such that we can pivot and integrate it with different verticals within the legal space. Document production for corporate minute books is just a few clicks away from document production for all kinds of transactions, for litigation, etc. So by virtue of things like the Legal Innovation Council, we are able to present ourselves as thought leaders and therefore position not only MinuteBox, but our team as visionaries when it comes to leadership and solution-based offerings in the global legal market.
Sean, it's Mo.
Hi there.
Hi there. What would you say is your unfair competitive advantage?
Well, I would say there are three, and they all relate to what I'm showing you over, whoops, excuse me, here. It's simple and easy for me to write this on a computer screen that we can easily migrate over from pre-existing legacy softwares. It's much more difficult to execute on that. And so that's not something that, for example, a particular engineer can just pick up and understand all the complexity and nuance when it comes to migrating over corporate minute book entity information. The second is related to our security. There's a difference between the security that exists in the current legal marketplace and what it is we have by adopting something that we've called end-to-end encryption. And this final component is in relation to document coding. So in theory, and I will gladly concede that there are pieces of what MinuteBox provides that can be provided by other solutions. Storage component can be provided by something like Dropbox. A database can be covered by something like Excel. But that's not good enough for law firms anymore. They no longer want to have systems that are diversified, that don't speak and communicate from one to the next. And so we've been able to present it in a very unique and user-friendly way that's been designed by a team of lawyers who have dealt with this pain point. Now, additionally, what's being developed is a very seamless transaction creator. That is to say, if ever you need to do something like a Section 85 rollover or a major transaction, even that has been reduced to a single button click. And unfortunately, I can't show you that here. But once that permeates into the market, once the market actually sees it, we're fully aware that this could then become a global solution that law firms worldwide will desire.
Sean, I hate to do it, but your time is up. Outstanding presentation. Thank you very much. Could you please unshare your screen?
Certainly.
And go on your way. Have a great evening, and we'll be back to you shortly. In a day, tomorrow, with how things worked out. So we're going to spend the next 5 minutes, and the judges will fill in their scorecards, and we'll come back at that time. But in the meantime, I'd like to announce that our winner from last night was Tenant Cube. Bum, ba-dum, bum, 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 bum. It was actually a pretty challenging time for the judges. The companies, like really every single one was outstanding. And I won't say it came to fisticuffs, but there was some, competing opinions. But ultimately, Tenant Cube came up on top, and we'll announce the winner for tonight tomorrow at the same time. We'll be back at the end of this period of judging and with our second presenter.
Thank you very much. It's been a real pleasure. Have a great evening, everyone.
Thanks, Sean.
Thank you.
Bye-bye.
Yeah, Jeff, it's Mahendra. I don't need to complete the judging thing. I think we've got enough judges, right?
Yes, that's right. Thank you.
So I'll stay. I know I've got a million questions for Sean, but
Just remember, everybody can hear you. You're still, just because
okay.
we don't have a presenter, your audience can hear you. Now we have our next presenter.
Hi there.
Hi, can you give us, hi, this is Renee.
Yes.
So give us a few minutes. We're just judging the last one, and the judges are filling out their forms. So we're just, this
Okay.
is how to get you set.
Okay.
What's going to happen is when we're finished this, you're going to share your screen and get started. Okay. And
Okay.
we'll just sit tight for a minute or two. Thank you.
Okay. No problem.
And you're with Daya Lens, right?
Dialens. Yes.
Daya, sorry.
No worries.
Well, you'll get started in about 2 minutes.
2 minutes? Okay, sure.
Just so everyone knows, we have, in addition to our judges, we have 11 other people watching from home. I know a few of them are some Fasken people. Our summer students are joining us. They had kindly volunteered to help, but we didn't need the help. It was so easy with this Zoom webinar app that we just didn't need any more help. But our summer students were really interested in helping out, and it's a tough situation because they get the summer to work in a law firm and see what it's about, and then coronavirus, so they don't even get to go to the office. So we're trying to figure out ways to make this a meaningful summer for them.
Awesome.
All right, you're up. So
Okay.
over to you. You've got 10 minutes to do
Okay.
your presentation, and then I'll probably rudely interrupt you. And then you'll have 10 more minutes of Q&A, at which time I'll interrupt again, and that'll be that. So good
Okay.
luck, and away you go.
Thank you. Let me just see if I can share this. Doesn't
We
seem
can
to be-
see it.
You can see it? Okay.
We see it. It looks like your PowerPoint, like it's not in the slideshow mode.
Yeah, well, sorry, I'm just gonna quickly pull out of it and,
Melanie, start timing once she's got it all set up, okay?
Yeah, no problem.
Thank you.
okay, so thank you everyone for having me today. My name is Renee and I'm with Dialens. So just a little bit about me. So I am the CEO of Dialens. I'm also a registered psychotherapist. And my background, I've worked in as a return to work specialist and also as a certified clinical trauma specialist. And sort of what had drawn me into Dialens is one of the big presenting problems that we're having in society right now, particularly around PTSD. So looking at first responders initially, at any given point in Canada in particular, there are up to 20% of first responders off work due to PTSD. So if you're thinking about, especially with coronavirus and a lot of the challenges that we're facing right now, we know more than ever before that PTSD is a big issue, as well as the frontline staff that we're helping need all the support that they can get. Moving on from just first responders, mental illness in Canada is a huge issue, which is costing the Canadian economy billions of dollars annually. And with PTSD in particular, it can take quite a few months to years to help individuals resolve some of these challenges, especially if it's not attended to very early on when they are starting to experience some symptoms. And just mentioning the coronavirus, so we are going through between first and second wave right now, but the experts that are studying the coronavirus have discussed a fourth wave, which will involve a lot of mental health fallouts and challenges, both with this population and then the world on a whole. So we do know that the rates of illnesses such as PTSD are going to be on the rise. So with individuals who are seeking treatment for PTSD, one of the most important types of treatment is exposure-based therapy, where an individual is gradually exposed to things that are symptomatic to them, and it allows them to build up a sense of mastery gradually so that they're able to go back to doing the things that they enjoy doing as they work through their PTSD symptoms. But what can make this quite difficult are some barriers, such as the exposure environment can be difficult to control. This is both for the individual who's seeking treatment and a treatment provider to sort of facilitate this treatment. It can be costly and very time consuming. Most in-office therapists don't have the time to attend an exposure therapy site with an individual. And there's often very little capacity for gradual re-exposure. The environment is unpredictable, and so too can be some of the elements that would help to facilitate a successful exposure treatment plan. So with PTSD, even though it sounds like it could be quite tough, there are proven treatments that do assist and help people recover. When PTSD does not have exposure therapy in the process, the recovery rates are between 40 and 60%, and that rises to about 60 to 80% when exposure therapy is paired. So it's quite vital, even though there are some huge presenting problems with being able to deliver it. So what DiaLens is looking to do and is starting to do is to create a virtual reality simulation system which allows therapists to recreate distressing environments, sounds, and other triggers in office with their patients, which will allow them to be able to provision exposure therapy treatment, but all from the comfort and convenience of their offices. Our device is portable, so we're using a VR headset as well as compatible laptop. The therapist can control the environment and the triggers. They can see what their patient is seeing, and it also allows for the patient to build up their resiliency and decrease stigma all right in the office. So how we're going to do that is it's a 4-step sort of program. So the therapist will work with the patient to orient them to the system. They select a scene either together or with the therapist's guidance, and the therapist can choose whatever exposure sounds and elements that they want to integrate into the scene. The patient will use the VR headset to go through a scene, go through some interactions with a patient, as well as be exposed to some of the triggering sounds and scenes. And then the therapist is able to evaluate the patient in real time and adjust their treatment as needed. So just give some demographic information. So within both Canada and the US, within Canada, there are about 250,000 active duty first responders. But we know that just looking at Canada alone, there's that about 700,000 first responders will experience PTSD in their lifetime. There are also quite a growing number of individuals and mental health therapists who are provisioned to provide treatment to both first responders and other individuals with PTSD. So there is a huge market out there that can use this product. And just in terms of the numbers, so both in Canada and the US, we are spending as a population a lot of money on mental health treatments, largely out of pocket, but regardless of the source, this is an area that is going to see a lot more expenses as especially coronavirus progresses. So with our product, we are targeting mental health therapists starting with Canada and eventually shifting into the US markets. We anticipate that we would be able to capture about 5% of the overall therapist market and 10% of the dedicated Canadian PTSD providers. So within most provinces and territories within Canada, their workplace safety and insurance boards have dedicated therapists who have identified themselves as individuals who can work with this population. Our device, it's an initial investment of $3,000 for the hardware and for setup, with a $120 monthly package software fee. So they will get different exposure environments for some of our core professions within the first responder market. And then there's also continuing education courses, which would be about $500 for a one-day training. We're also looking at a white label and enterprise solution to provision to some of our, to some larger groups, so like a WSIB who has some pull over what their treatment providers use. So our revenue model, just as I sort of touched on, is through product sales, licensing, and also continuing education. Continuing education is quite huge in the provider market. And this actually leads into our go-to-market strategy, which allows us to teach individuals about the product, about the usefulness, but also sell to them at the same time when we're offering these courses. The competitive landscape, so we have two competitors at this time, Virtually Better and UCF Restores. Virtually Better does a lot of you have virtual reality scenarios with phobias. They have one exposure treatment scenario for veterans who are experiencing PTSD. The retail price is $20,000 US, so it's quite out of reach for the average therapist, and it also doesn't fit very nicely in most therapy offices. UCF Restores also has one virtual reality scenario for veterans. They don't have their product on the market. It's only for in-office use in Florida where they treat their patients. Our achievements thus far, so our company was founded just a little over a year ago. We've completed our prototype to MVP. We're also now registered as a medical device level 1 with Health Canada. And at the beginning of this year, we were accepted into the DMZ program to help with business development. Following that, also registration with the biomedical zone and launch YU. And in this month, into the next few months, we are looking at doing clinical testing with local providers. Our go-to-market strategy, so it's primarily business to business. So we're looking at key stakeholders within, starting with larger institutions like hospitals and safety and insurance boards. We're looking at reaching individual therapists through continuing education webinars to collect, just basically get a lot of therapists in the room and teach them about our product. We're looking at doing clinical validation once we're able to and have the funding to do that on a more sort of research-based setup with the biomedical zone. And after we gain some traction in Canada, we do have some key supports to enter the US veterans market. They've already expressed some interest in our product. Once we're able to show clinical value with this offering, they're looking to have us adapt something for their veterans in the United States. So the team consists of myself. So again, I'm a psychotherapist, our technical advisor, and some other advisors for the team. And it's right now just me working very closely with our senior VR developer. He has over 15 years of 3D and VR experience in programming. And so as we grow, we will look to grow our team to be able to get things up and running even faster than we are currently. So our next steps right now is getting those early adopters in. We just recently have 3 people that agreed to test and possibly buy our product. We had to pivot away from doing a formal clinical research study right now, and we're going just at the individual level to build some traction and use those case studies to garner more buy-in with our product, as well as additional training and awareness. We're developing out our webinars and our presentations to educate people on what we do.
Renee, thank you very much. And it looks like my timing is
right
perfect.
on there.
You're right on. You're right on time. Thank you very much. Great presentation. So we're going to spend 10 minutes now of Q&A with our judges. Who has the first question? Snitza.
Thank you. Renee, thank you so much. It was a very good presentation, very informative. My
Thank you.
question is around, you mentioned the clinical studies. I would love to see if you could dive a little deeper on like, what does that journey look like? What is the path to clinical studies before? And I would love to hear more about that.
Certainly. So this is, I should sort of preface that with, this is a product that we're not assuming that, oh, does this work? Does this not work? There is a ton of clinical research that shows the efficacy of both exposure therapy and virtual exposure therapy.
Okay.
So we would use that, or the sort of a premise for a clinical study is to help some therapists gain some confidence in our specific product by seeing like, hey, how did this exact product work? But because we do have a lot of clinical research backing this, we also thought we can just go right to customers and try to get some early adopters on board, and get them to try things out and get the feedback in order to either sell to them or to sell to bigger markets.
Thank you.
You're welcome.
Zavash, I think you had a question.
Thank you very much for your presentation. I think it's definitely important to, find products that could, benefit the society and, the first responders and others who are under such pressure. So my question may be a two-part question, but when it comes to the 5% of the market that you're hoping to capture, can you dive deeper about like a concrete plan? Because it seems like there are moving pieces, and if you can explain that, and as well as, just the overall adoption when it comes to, I know you mentioned the exposure, the virtual exposure therapy, but if you can explain how much of the market is actually open to trying these kind of solutions. Thank you.
Yeah, for sure. And thank you. So with the first piece, so with the mental health therapists that offer psychotherapy for PTSD, some therapists don't touch PTSD at all. Some do, but this may not be their their only customer, their only client. And so in sort of looking across different professions between OTs, psychologists, psychotherapists, the whole gamut, we're believing that about 5% of that population, especially going for some of these larger hospital groups that are tied to some of these safety and insurance boards. The safety and insurance boards have collaborations with a lot of different mental health hospitals. We believe that we would be able to capture that portion of individuals, especially believe that we can capture that portion of individuals if they're outside of that network. But then within the dedicated market, I think to your point about like who would use this, there's definitely a learning curve for some, maybe therapists that are very used to doing things a certain way. But with some of the other professions like occupational therapists and social workers who maybe like a younger population coming up, they tend to bounce around to a lot of different sites. We believe that there'll be a lot of value, as well as we're looking at adapting our product into a mobile option, which with COVID and the barriers with mental health, like even right now, the colleges are still very much saying, do online therapy where possible. There are remote first responders that can't reach and get therapy on a consistent basis. So I think as bad as COVID is, it might have shifted some of the perspectives on using the technology.
So I have a question. Renee, thanks for the presentation. Why VR though? Doesn't that cause more stress when people go online anyways? Wearing a headset in a different world?
It possibly could, but this is where it could be even more stressful, throwing them into scenarios where there's no control over what happens. So the idea behind VR is that it will allow the treatment to be experiential, but because the therapist is controlling what the person is seeing, they can choose if having someone attend to a patient at nighttime when it's raining in an alley is too much, they can scale it back and make it a daytime thing. So they still give the person that experience, they can still grade the experience, but it's immersive, which is something that in office, because a lot of therapists don't go outside of the office, they're getting someone to close their eyes and envision things. And it's not the same as being out there and doing it. So this is sort of a bit of a bridge to going back to your day-to-day life, experiencing these things on the fly, but we're trying to control that a bit with VR.
Thank you.
Renee, I have a little question about how do you populate this scenarios for you to elicit a response from your patients? I'm not
Yes.
clear.
Yeah, so we're taking some common work sites for primarily since it's first responders, some common environments that they might experience, and through some of the research that we've gone through, common triggers that so a lot of times it's a lot of auditory triggers, so sirens, dogs barking. We also have a portion where they're interacting with the patient in the scene. So it doesn't have to be a verbatim match to their own personal experience with PTSD, but it's to have enough of some of the triggers in the environment to have their own bodies and their own minds sort of bring them back to these stressful environments. So, so to answer your question, it's getting some of the common triggers that they might experience, and then allowing them to work with the therapist. The therapist would also be working with a person outside of the VR environment to help them with coping with some of the other residual symptoms and processing their PTSD experience. So it doesn't have to be an exact recreation of what happened to them.
Hazem, did you have a question?
Yeah, Renee, let's say if you want to put a timeline for the product to be ready, in terms of research and proving that it's actually working, what the timeline would be like?
So we could go to market just to get everything uploaded to the server to sell within the next month. The product, we do have an MVP, so it is usable. It is something that people can use in office right now, and the research supports that this can do what it needs to do. In order to have our own research, just saying like, hey, we tested it with our own stuff, that is a little bit more dependent on once some of the research hospitals open back up and start up their process again. But it's not a barrier to us going to market.
Okay.
Sorry, and how long do you feel will be the sales cycle, typical sales cycle?
Typical sales cycle, if it's for a therapist, it would take about a week and a week and a half. It would just be making sure, the main part that would be, I guess, a little bit time consuming is just to make sure that they have the equipment so the VR, it's an Oculus VR headset and compatible laptop. If it's for a larger institution, just based on what their purchasing cycles might be, it would probably be somewhere around a month to 2 months if reasonable. It just depends on the time of year that we would approach them and get that initial.
But it's an assisted sale, meaning someone has to go and meet them and have that conversation, right?
Yeah, so thankfully, so I was on the WSIB's mental stress team. So I worked with them. So they are one of the bigger institutions that I'm approaching. So we're in ongoing talks right now. Had a few people that have left the company, so it's kind of just delayed a few things. But if we get their buy-in, for instance, that gives an opportunity to work with UHN and gives an opportunity to work with CAMH. And from that, we should be able to build some quicker traction with some uptake.
Right. Were they stressed too?
Are they stressed? Oh, they are stressed. Yeah. I should develop something specific for them, but yeah.
Right. Perfect. Thank you.
Thank you.
We've got time for one last question. Does anybody have a question? Well, Renee, go ahead, Zavash.
I just wanted to ask about the partnerships around positioning your product in a way that's efficient when it comes to the burn rate that you have, because if there's a lot of experimentation, have you really thought about finding a approach that would be cost effective?
Yeah, so in terms of development, now that I have that was one of the harder parts, finding someone that's skilled enough to do some of the types of program that we want. And now I sort of know where to look for those individuals. It would take honestly about 3 weeks once we've gathered the research on like some of the common triggers or environments, and because of my clinical background as well, that assists with the speed of doing that. A way to sort of reduce some costs would be to look at adapting this to other ER headsets for use. So some cheaper modules. We're looking at things like using Google Cardboard. So it should cut down on the cost of the actual physical hardware.
Renee, that was a terrific presentation. Thank you, but we're at time.
Okay.
So you'll have to leave us now. So
Okay.
go on your way and we'll let you know tomorrow what happens. Judges, you now have 5 minutes of quiet time to
Thank you,
complete
everyone.
Thank you, Renee. Judges, you now have 5 minutes to complete your scoring cards. Again, please remember to fill in the comments, and I'll be back to you shortly. Hi, Mark.
Hi, everyone. How are you?
Good. The judges are just filling out their scorecards from the last pitch team.
Yep.
So just bide your time. In about 4 minutes, we're going to give you the green light. You'll share your screen. You'll have 10 minutes to do your story, and then I'll interrupt you, and then you'll have 10 minutes of Q&A from our judges. And then that'll be it. And they'll do this all over again and fill out forms. And the decision will be made later tonight. And that's it. So good luck. So I'll let you know when you can go.
Fantastic.
And we're all live now. So, careful what you say.
Of course. Yeah. Thank you.
All right, I think we can get going. So Mark, why don't you share your screen? And we have Mark Elias of Steadyware. So whenever you're ready.
Certainly. Is my screen visible?
Yes, you may want to put it on. Yeah, there you go. You're all set.
Good. Good evening, everyone. My name is Mark Elias. I'm the co-founder and CEO of Steadyware. And our mission is to restore independence and quality of life to all those who suffer from tremors around the world. Imagine waking up one day not being able to feed yourself, drink a glass of water, or dress yourself. Essential tremor and Parkinson's disease cause debilitating hand tremors that make the simplest daily activities, such as eating, writing, and drinking, a real challenge. There's also a social component to this condition, as tremors very often lead to social isolation and depression. And that's why we've worked tirelessly to develop the Steady One, our first version. The Steady One is a lightweight, compact, and responsive glove that stabilizes the wrist joint. It uses our novel battery-free damping technology, which combines a ball joint and a smart fluid to resist tremors while allowing voluntary motion. Our system is FDA registered, Health Canada approved, and currently patent pending. This is a sample video with one of our beta testers, John. He has very severe tremors and has tried everything from surgery to medication. So our clinical trial is at the 50% completion mark, and the top few results are looking great. So we're seeing that 80% of the patients experienced objective improvements in activities of daily living, and 60% of them experienced meaningful improvements. And now this totally correlates with our soft launch data, which is showing that 60% of individuals experience significant improvements in activities of daily living. A brief note on intellectual property. So we have 2 filings currently in the PCT stage. And the claims are actually quite broad, which allow for potential licensing opportunities in other sectors, such as camera tripods, construction equipment stability, as well as other applications in the military. Now, what are patients currently resorting to? Well, we have medications such as propranolol and primidone that were never designed for tremors and cause a wide array of negative side effects. Secondly, we have weighted objects like weighted pens or weighted gloves that purely rely on weight for stability, so it causes a severe strain on the wrist. We have the liftware spoon, a very elegant spoon that helps with eating. It's a self-stabilizing spoon actually acquired by Google. It's quite effective, but only helps with one activity at a time, which is the drawback of this category. Finally, looking at some emerging tech like GyroGear and Calihealth. So they're still in the development stages, and they actually suffer from the same problems. Number one, they're extremely expensive and not covered by insurance. Cost over $2,000 a unit at least. And they can only be used for about half an hour a day. So it's actually very clear that the Steady One has a strong competitive advantage because it provides on-demand stabilization as it's battery-free. It exceeds the efficacy of devices on the market as well as emerging technologies, and it's quite affordable. Looking at our business model, it's quite straightforward. In North America, we've implemented an e-commerce model where the glove is sold directly through our web platform. Of course, those sales are driven through elaborate online marketing strategies, Facebook, Google Ads, and working with international essential tremor foundations. We're also in communication, and we have relationships with over 50 neurology clinics across the US and Canada. And we are aiming to deploy our units there as demo sites once the COVID pandemic simmers down a little. Now, moving on to medical device distribution. So we have one Australian distributor already secured, and we're currently in the sampling acceptance stage with European distributors, in Korea as well as Japan. Now, this was a much bigger problem than we expected. There are actually 230 million individuals with tremors around the world, 10 million of which are in North America. Now, as the Steady One will benefit 60% of the tremor population, we're looking at a total addressable market of $4.8 billion in North America with an $800 price point. Looking at unit economics, we've done some extensive market development work with our online strategy, working with a PR firm. And we were able to conclude a customer acquisition cost of $160 per unit. And of course, our objective is to reduce this cost with time, and we can bring it down to $100, if not less. Looking at what we've done so far, in 2016 and 2017, we built our first prototypes and completed alpha testing. In 2018, we signed our first clinical trial contract, got our regulatory registrations in place, and completed beta testing successfully. Now, in the first half of 2019, we set up our supply chain, started the clinical trial, and ramped up market development. With a soft launch in the second half of the year, we delivered 100 units to early adopters. We delivered 100 units to early adopters and signed our Australian distributor. Now, from our soft release, we learned a great deal, especially looking at the feedback from all our early adopters. The device currently is on the heavier side. So the new guideline is that it must be under 1 pound. Secondly, it currently takes 3 steps to don and adjust the device, and we've concluded that it should be a maximum of 1 step. Thirdly, we learned that the main stabilization requirement occurs during drinking specifically. Fourthly, the production, assembly, and quality control processes for this version are currently too complex and costly, as it requires extreme tolerances. And finally, we learned through a price sensitivity analysis surveying over 1,000 patients that the sweet spot price point should be $500. And of course, we've implemented all of this into our second version. The Steady 2 is a version that's currently in development in collaboration with the University of British Columbia. The device is going to weigh half a pound, extremely affordable at $500, $80 cost to make, and of course, its efficacy far exceeds the first version. We have extremely promising results from our proof of concept currently, and we're really excited about this. And the system is patent pending currently. Moving forward in 2020, our next immediate milestones include rolling out 50 Steady 2 units to a clinical trial in British Columbia, as well as to our early adopters here in Toronto. And we aim to do a pre-order campaign for the second version later this year. In 2021, we'll enter the scale-up phase with 2,000 units sold. Moving on to 2022, we project $3 million in revenue with 6,600 units sold. And in 2023, $6 million in revenue with 13,000 units sold, and potential exits through medical device distributors or other vertical sectors where our technology applies. Of course, none of this would be possible without our brilliant team. My background is in structural dynamics and entrepreneurship. Emil's background is in marketing and management. Michelle Saba, our research associate, has a master's in biotechnology and has experience with drug development specifically for Parkinson's disease. Sapna Patel, our operations manager, has a master's in e-health with experience in hospital management. We work with Leonardo Araneta, our lead product designer. And of course, Dr. Hadi Mohammadi from the University of British Columbia, a vibration mechanics professor, and Stefan Kamadzi, PhD candidate in vibration mechanics under Dr. Hadi. And we work very closely with our R&D team. And of course, we have a well-rounded board of advisors with Charles Plant, a serial entrepreneur. Patrick McCarthy is the director of the International Essential Tremor Foundation. Dr. Philip Rzek, currently running our clinical trial. He's a movement disorder neurologist who specializes in advanced treatments for tremors. And of course, Fiona Gao, a full stack marketing specialist. She was previously at Google and eSight, and she's been incredible to work with. Overall, our company's reached a very critical stage. Our next immediate milestones, which are extremely important, include manufacturing a batch of 50 units to deliver to our early adopters, as well as to our clinical trial with a senior living facility to ramp up validation and move forward to the next step, which is to commercialize the second version. And with your help, we can deliver this much needed solution to all tremor sufferers around the world. Thank you.
I've already started talking, but I was muted. I'm sorry. That was an excellent presentation. You're right on time. as well, so you get brownie points for that.
Fantastic.
Now it's time for Q&A with our judges. Who has the first question? Mo?
Go, Jeff. Yeah. Okay,
Fire
Mark,
away.
great presentation, Mark.
Thank you so much.
I've seen your presentation before. I'm glad you've got traction now and you're going ahead with the whole plan. Question for you. I'm not able to correlate. You say the market size is 4.8 billion and you're expecting to do 13,000 units in 2 years.
Yes.
Why so little?
Oh, well, you know, those are actually conservative projections. We project something closer to 25,000, but you know, we like to remain conservative, as the least amount possible we can sell would be that much. It was just a conservative measure in our projections.
Right. Okay. Thank you.
Any other questions?
Hi, Mark.
Hi, Linda. Go ahead.
I think I've seen your presentation before. Thank you. Even since you presented before, things are moving forward. I don't remember seeing this new model, so that's terrific. Can you give us a little more detail about who the target market is? I mean, everybody that has this issue, I mean, there's certain sort of age groups, or, you know, who makes the best customer?
Absolutely. I mean, that's a great question. So looking at the disease-specific target market, we're looking at essential tremor and Parkinson's disease. So we do see that in both ET and Parkinson's, you know, it really involves an age group of 40 plus. In essential tremor, sometimes we do see a small peak at the age of 25 of onset, but that's really a much smaller representation. Now, in terms of who we're selling to, so we usually see 3 different scenarios. So we're either selling to the person directly, to the tremor sufferer directly, the tremor sufferer's spouse, or the tremor sufferer's caregiver, children, etc. So we actually have different marketing strategies targeting these different segments. You know, the language changes when you're targeting a child versus the patient directly. So we do have different strategies for different demographics.
Zavash, you're muted.
Yes, thanks, Mark. Great presentation. I have 2 questions. One, it would be nice to hear what kind of got you started to pursue this particular, you know, project. And my other question is, how long before the second model is ready?
Great. So how it started, I actually have you know, many individuals in my family that have tremors, you know, including my aunt and my grandmother, and you know, witnessing their struggle with daily activities firsthand really really motivated me to you know, to solve this problem once and for all, because I was really disappointed with the solutions in the market. Of course, when I found my co-founder Emil, I realized that his family had tremors as well. So we're extremely motivated and passionate about the space. In fact, many individuals on our teams have witnessed this problem firsthand. So that's what really unites us as a team. Now, in terms of the second version, we've actually completed very extensive numerical models. So we were able to optimize the system, and we built tremor simulators. So it's something that induces tremor in the hand, and we were able to optimize it further. Right now, you know, we're ready to manufacture 50 units and deliver it to users by the end of July. We expect the users to have it for a month until the end of August. And we expect to launch a pre-order campaign in the next month with a delivery in the new year. That's sort of what the timeline looks like for the second version right now. Yeah.
Thank you.
Hazem, did I see you wave?
No, I didn't. Thanks.
I have a question in there, Mark. Great presentation. I love that this is a problem you're solving based on a passion area. I'm curious around the supply chains. Has COVID-19 impacted your supply chain at all, or your thoughts around that?
Yeah, that's a great question. You know, we were quite lucky. You know, trying to beat Chinese New Year's, as our supply chain is in China. We actually got our stock in before Chinese New Year happened, and we got it shipped out to our fulfillment house before the COVID pandemic hit. So that really eliminated our supply chain risk. And in fact, we've had to order a few more units, and our manufacturers are fully operational. So we haven't really seen any problems with our supply chain so far, which is good.
Thank you.
Mahendra, fire away.
Yeah, Mark, thank you for your presentations. I think I met you before, maybe last year in one of the judging sessions. You've come a long way with your business. So again, congratulate you on all the effort that you've made. So just explain to all of us the $1 million US that you're seeking. How will you spend it? What is it for?
Absolutely. So, sorry, this keeps coming up. So for the $1 million, at that point we would have eliminated the technical risk with the clinical trial as well as the rollout. So the $1 million would serve multiple purposes. Number one, of course, marketing expenses. We would hire Fiona Gao as a marketing executive, and of course allocate a lot of scale up capital to the operation, representing around 30% of the round, which would go to marketing. We would spend 15% of the round on research and development, improving upon the existing versions, as well as allocating a small budget to looking at vertical sectors, which we think is quite important. Another 30% would be allocated to manufacturing, of course, because this is a hardware company and we do have a lot of manufacturing overhead. And the rest would go to general operating expenditures.
Okay, thank you.
Hazem, did you?
Yeah, I did. Thanks for Mark for the presentation. Just actually a quick question: is it waterproof?
Oh, we've actually designed our way around that, because the first version was actually so sensitive to tolerances. We made it. I have it actually here with me. So we made it detachable that way, and this can be thrown into the washing machine, and that's what our clients have been doing, and it's been working fine. We are looking at making the second one waterproof, as it is much easier to manufacture and easier to waterproof. Actually, we have ways to do it.
Would the second product
yes,
be deployed? Yeah.
Exactly. Yeah.
Thank you.
Mark, is this product covered by any insurance plans?
Sorry, Kumar, I didn't quite hear you.
The question was, is it covered by any insurance plans? Will the patient be able to recover the cost through their insurance?
That's a great question. So we've actually been working with a reimbursement firm in the US, exploring all options, and we actually found a very viable one. Every state in the US, as well as in Canada, has an assistive device program for reimbursement, and we've actually had multiple of our clients, have the product covered by those different bodies. So what we're doing now is we're reaching out to all existing assistive device bodies and actually creating a platform on our website to educate the customer. So it is covered by assistive device programs. However, in terms of Medicare coverage and sort of that route, there is no code that currently covers our device. But there is the potential to explore creating a new code in the future. But in the meantime, sticking to those assistive device programs that are already covering the device is the best way to do it at this point. Yeah.
Zavash, this was the last question.
Sorry, I have one question. Sorry. Quickly, Jeff. Do I have time for one more?
One question only, guys.
Sorry, what's your valuation right now, Mark?
So right now we're looking at a $4 million pre-money valuation for the raise. We already we had secured a safe, last year to help with production of the first batch, and now we're ready to raise a full round. Yeah, and we've been in discussions with a few groups. Yeah.
So thank you, Mark. Thanks, judges. That was a terrific presentation. Thank you. So stop sharing your screen, please, and let yourself out. Okay. Judges, you now have 5 minutes to complete the scorecards. and make your comments. Remember that the comments are really the most important thing for these companies to take away from this evening. And our next contestant will join us shortly, so we have 5 minutes. Thanks, Mark.
For your time, everyone. Thank you.
Thank you.
Thank you, Mark. It was great.
Thank you.
Guys, hello.
Hi, Taylor. How are you? Welcome.
Yeah.
So the judges are just finishing their scoring of the previous group, so just sit tight. We'll get started in about 4 minutes. We're live, so we do have an audience, so behave yourselves. What you'll do is when we're ready to go, you'll share your screen and then do your thing.
Sounds good. Awesome.
Okay, guys, so we're just about 3 minutes away.
Okay. Okay. Yeah, ready to go? Sure. Ready to share? A little different doing it this way. Yeah. Actually gonna test it out. Right now? Yeah, I'm just gonna share and then just gonna check if the audio is good. Share computer sound. Okay, you have to click that. Can anybody see that?
Yep.
Yeah?
Yeah, yes, it looks great. Yeah, we can see it.
Awesome.
Yeah, we can hear you too.
Yeah.
We're going to start in 1 minute, so start your engines.
Awesome.
Is everybody back? I can see the top of Mahendra's head, so he's there.
Yeah, I'm here.
So everybody, we're joined now by Taylor Vince and his partner, whose name I can't remember. I'm sorry, he'll introduce himself in a moment. They're from Vinostics, the last presenter of this evening. Guys, you have 10 minutes to do your presentation, and then I'll interrupt you, and then we'll have 10 minutes of Q&A, and then the judges will do what judges do. So it's all yours, Taylor.
We can start?
Yep, go ahead.
Vinostics, collision repair marketplace.
We have a short video we're playing for you.
Body shop owners and suppliers, they don't have a way to connect. And as a result of social distancing, everyone's looking for a digital solution.
Hi, my name is Abrar. I'm one of the co-founders of Venostics and also a co-founder of Iffy's Auto Body Paints and Supplies.
Hi, I'm Taylor Vince. I'm a co-founder of Venostics, and I've been involved in the automotive collision industry for over 4 years, representing over 30 different manufacturers. The greatest problem that exists in the automotive collision industry, especially more now than ever, is the disconnect. The disconnect from manufacturer to supplier, from supplier to supplier, and from supplier to body shop.
The ways that a product actually reaches the body shop owner is it's created by the manufacturer. So once it comes off the assembly line, the manufacturer would then market that product to the supplier. Part of the reason manufacturers aren't able to reach many suppliers is the communication. It's face-to-face, it's over the telephone. It's sort of like a slow process. The wholesale distributor then has to market to its network of suppliers. It's usually a limited network based off of, again, their geographical area. And then once it reaches a supplier, it then goes to, they then actually market that product to their network of body shops that are in their locale. It's just sort of like a marketplace that's purely based off of face-to-face relationships.
You got to pretty much call around and shop from store to store, see who has the better price. But you know what? That's a hassle. It's a waste of time. Mainly, the worst thing is the waste of time you're doing on the phone trying to find a better price when you could be working on a car, right?
Manufacturers are used to having sales agencies go and visit the shops face to face. And as a result of COVID-19, manufacturer agencies are no longer on the road.
Finding those same products that you're used to using online is something that would appeal to a lot of suppliers and a lot of body shops.
Venostics is that marketplace designed for an entire industry to become an interactive community.
So Venostics is a marketplace in which, you can go online and you can find your day-to-day products that you use as a body shop owner, and you can find them at a competitive price where other suppliers would then be competing for your business, making sure to get you your product that you're used to using for the best price possible.
You don't got to go shop around. You just punch it in and see who gives you the best price. In a way, this opens up a lot of doors for a lot of shops that don't have the chances bigger shops have.
And it opens up the possibility for suppliers to also market their products to body shops that are outside of their locale. And it sort of networks and connects the entire industry together.
Selling with Venostics is amazing because we empower suppliers to really grow their network of body shops without even leaving their warehouse.
We're basically creating a network for manufacturers to reach different wholesale distributors that were previously unavailable to them just purely from geographical area. Then we're creating a value prop for wholesale distributors to network with other suppliers in the industry and to kind of open up their horizons and to kind of meet people from other countries as well and kind of just open up communication. And then for suppliers to body shops, our value proposition is to sort of network and connect and make it easy for them to sell their product, get competitive pricing, and not just be limited to the body shops or the suppliers in their local area.
The business model is based on reasonable transaction fees and subscriptions. However, we use a freemium approach to facilitate rapid adoption and eliminate risk to our customers. With Venostics, you do not have to pay until you are already making a profit from our platform. So we have over 30 body shops and over 10 suppliers currently using the system. So we're very excited with where we're at with Venostics today.
So our next steps for Venostics are actually to onboard both more body shops and more suppliers to tell everybody that Venostics exists. We're out there and that it's something that really anybody can use.
We are also looking for a financial partner with experience in marketplaces or automotive supply to help us grow this exciting platform.
To find out more or book a demo, please contact us. Together, let's transform the way the collision industry does business.
Collision supplies sucks. The $400 billion North American market sees an inefficiency of an estimated $176 billion annually. COVID-19. Need I say more? COVID-19 has made the old way of buying and selling supplies impossible, nearly collapsing an entire industry.
So the key advantage that Venostix presents is it's an online marketplace for automotive supply, for everyone in the automotive supply industry to connect to. It's an advantage that was previously unavailable actually in this space.
Buying with Venostix is awesome, and it's unbelievably easy to use. It's as simple as log on to the Venostix marketplace, register an account as a body shop or as a supplier, search for the products you need and build a cart. Submit your cart for bid and request the delivery date, and then decide the winning supplier and receive your order. Venostix is so easy to use, there's almost no learning curve. If buying with Venostix is awesome, you have to believe that selling with Venostix is awesome too. Manufacturers have instant access to the Venostix ecosystem of wholesalers, jobbers, and body shops. Wholesalers and suppliers can sell to each other as well as win new business without incurring unnecessary business expenses.
So we generate our revenue from various sources, including collision shop subscription fees, seller fees, and manufacturer paid advertising. A lot of our current revenue is being put towards sales and marketing and towards consistently improving our platform. Our gross margins are estimated to be in excess of 80%. So our initial break into the market will be Ontario. It's a market we're very familiar with. We have long-standing existing relationships in Ontario, as well as we have many industry partners that are familiar with us. Our next venture would be to the rest of the Canadian market. And our next natural step after that would be to branch off to the US market. It's a market that's actually 40 times bigger than the Canadian one. So of course, it's where we'd want to go next.
What's changed? Nothing. We've continued developing and enhancing our software for almost a year now, and the automotive industry needs it. Why now? I mean, anyone who was reluctant to purchasing online before is now demanding a digital solution. Our opportunity is right now.
So our current largest competitor in this space is how the industry operates as a whole and just changing and buying habits of everybody who's involved. Luckily, COVID has actually made it so that people are demanding an online marketplace for their collision supplies. A lot of our competitors in this space, including one from the States, our advantage over them is that it's somebody that is an old mindset. It's somebody that hasn't connected all the layers of the industry, and it's somewhere that we can actually get in and get people to connect both manufacturers, suppliers, and body shops all in on one marketplace. And another difference is that we're launching like a local classified. It's similar to Kijiji, and body shops are extremely enthused about something like that because it's not something that exists right now in the marketplace at all. I'm a brewer. My family has been in the industry for 40 plus years as both a retailer and a wholesaler. We've got multiple GTA locations. We own and operate out of a 35,000 square foot facility in Mississauga, and we operate out of a 12,000 square foot facility in Baltimore. I have 10 plus years of industry analytics that have actually been tracked. And we recently ventured off into Baltimore, which is a 12,000 square foot facility, and we've been there for over 3 years.
I'm Taylor. I've been in the automotive industry for about 6 years, 4 years as a territory manager in Ontario, representing 34 manufacturers, having a call cycle of over 800 body shops and managing 50 different suppliers.
So we did a soft launch in March, and we had great success. We actually onboarded 30 collision repair shops and 8 suppliers. We took the time to iron out any kinks that were wrong with our platform and took feedback from both collision repair shops and suppliers. In the graph, you're going to see an accurate prediction of the future coming months once we officially go public, launching officially on July 1st.
And then in the graph, you're just going to see like like an accurate projection as to what that's going to look like.
Guys, I have to interrupt. We're at 10 minutes, so it's time for the Q&A. Who has the first question for Venostics? Snitza.
Great presentation, guys. So I'm going to preface my question with an assumption. The assumption I'm making is that the body shops is a fragmented place. There's a lot of small players. Like is that assumption correct or is that incorrect? Maybe start there.
Yeah, so it's an industry that has actually a lot of players, but it's an industry in which there's kind of pockets where it's hyper competitive, and then there's pockets which are not competitive at all. You'd have one supplier that's supplying 200 body shops, and they don't actually know that they're getting the best deal. So what we're trying to do is get everybody onto the platform, onto the marketplace, to really see if they're being charged fairly in the from whatever supplies that they're normally buying. If that answers your question.
That's a fair. So I guess the follow-up question to that is, how do you go about getting everybody onto the platform in a cost-efficient way?
So we mainly actually depend on the traction of our current. So it's such a compelling marketplace in which once you actually go on, we predict that you're going to be able to save in excess of 25% from what body shops are currently buying. So if a body shop is spending around $200,000 in collision supplies a year, they're going to look at saving around $50,000. So it's a very compelling argument. People would just kind of onboard from that aspect.
If I can jump in there, part of being an entrepreneur, it's amazing, and something we're just so recent and fresh in our minds is a referral program, or rather a revenue sharing for all of these supplier reps. Something cool about the automotive industry is once you get into it, you fall in love with it, and you stay for a long time. So these jobber sales reps, they have 20, 30-year relationships with these shops, and these shops want to pay it back and be loyal to those reps that help get them there. So we're starting a revenue sharing program that's going to allow those sales reps that are maybe taking a step back and retiring a chance to capitalize on onboarding that shop that they have a relationship with and getting revenue sharing for life as long as that customer continues to buy. So we're constantly coming up with new ways, and we believe that this revenue sharing model can really catapult us.
Zavash.
Hey guys, it's good to see you again. I do remember your previous pitch, and it seems like you're doing great. A couple questions for you. So from your early traction, what's the activity like, kind of looking at the data and from both sides of the marketplace, as well as what is your ask if you're raising currently?
So we were actually, we were super fortunate to be able to test our system prior to COVID-19. COVID-19, obviously, it's wreaking havoc across the global economy. And, typically in Canada here, it really shut us down. And we were really fortunate to be able to solve our system end to end. And we did. We still have about $10,000 worth of sales. And the customers that we onboarded knew that they were being a part of our controlled launch. When I went in there and did the controlled launch with the body shops, I told them, I'm not here to help you use the system. I'm here to observe and to see how you're using it so we can continue to improve. So we really improved our system. And then what was the second part of that, Savash?
Your ask.
How much money are you trying to raise, and what are you offering, I think is the question.
That's a tricky question. At this point in time, at this very moment in time, I don't think that we are trying to raise money because we are self-sustained. It's just a matter of onboarding more shops. Now that we have the system that's complete, we just take our revenue and ramp it back into our business to really grow. So to actually come up with a number for you is really challenging, just because everything's changing so quickly and it's so dynamic. We really don't have an answer because we have this system that's ready to go and it's ready to spread. It's a matter of just getting that word out there. So I don't think it's a matter of a huge capital injection in terms of marketing, but having like the right approach, like a revenue sharing model that allows people to capitalize on the relationships and for shops to stay committed to that relationship they had all these years.
Thank you. Maybe I
Linda?
missed it. Sorry.
A good presentation. Thanks, guys. A couple of questions. First of all, are there other members of your team? I'm imagining somebody developed your tech. Was one question.
Absolutely.
The other question, yeah, and the other question I had was, what exactly are we talking about here? Are we talking about car parts? Is that what the buying and selling is here? Thank you.
So I'll answer part one of your question. The team that we have, it's a company called Vertical Wave. It did start as a family business. They've been involved for over 30 years, specifically in automation. And our RT company, I mean, they're the best. I call these guys the horses. You know, you got to keep your horses well fed if you want them to run for you. And our focus has definitely been on improving our development and having a team. I don't know if anybody here uses Slack, but that's been super great for us in terms of having that interactive feedback to make sure we're on top of our development work and improvement.
When it comes to the supplies, it's not collision parts, it's actually collision supplies. So what body shops would use to actually repair a vehicle other than the parts aspect. So we're actually in one of our locations right now. So you can see, something like an aerosol can that helps, fill up a scratch and then they would paint on top of it. Something like that, just collision repair, sandpaper, masks, anything, in regards to repairing the body of the car.
Great, thanks.
Mo, I think Mo, you had a question.
I do. Sorry, guys, maybe I missed it, but what's your economic model?
So basically, what we intend on doing is to launch to the smaller market in Canada, which is a $7 billion Canadian market, and it's something that we're only going to be able to tap into about the first 10% of it in our first year. That's just with sweat capital, just going around and calling shops and kind of just having that slow growth of people being onboarded. And then we would venture off into the U.S. market, which is more than a $300 billion collision repair industry.
No, I get that. But who pays for it, and how do you make money?
Also, we basically get our revenue from subscription services from body shops. It's a free to use service, but if they want sort of more premium services, they can opt for a subscription, a monthly subscription. And for every dollar that's sold on Venostics from an actual supplier, we charge a 3% commission. And what's really cool about that, I do want to add, part of our soft launch, when I was onboarding suppliers, we were charging 8%. The fact that we're reducing that down to 3%, I think, it speaks volumes to the amount of these jobbers that we're really going to be able to onboard. Oh, and on top of that, advertising, manufacturers pay to advertise on our website. So that's another revenue stream. And we just completed the development work to have those ads present. We're just actually working through right now, kind of to answer your question as well, Savash, as bringing in manufacturer sponsorship money. I've actually been speaking to a few of them today to really cover our costs and our future growth of like our app and our Kijiji classified page. So we're just taking that. We're getting the manufacturers to support us, to support our initiative and making this a community for an entire marketplace, and we're running with it.
Right.
Question. Kumar.
Mahendra, I think you had a question.
Yeah, I would say it's a comment and a question. I think COVID-19 has definitely helped your business.
Oh.
I look at auto body shops as sort of in the dinosaur era when it comes to technology, okay? All right? I've yet to see a computer or even a laptop in a body shop, okay? So that's just a comment. So I think the fact that everybody had to stop and all that, I think has forced a lot of these people to go online on that. The other is a question I think you may partially answered, but why not a full marketplace? And by the way, the commissions you're charging seems to be on the low side, okay? So why not a complete marketplace where you intermediate between the supplier and the body shop, the customer, like a mini Amazon, okay?
So we actually know, we know our customers, and we know that charging a higher commission might scare off a lot of them because, again, they're guys that their bottom line really matters to them. So in order to facilitate rapid adoption, we lowered that commission down to 3%. It's a fair bit, and for the dollar value of what people would be buying on that platform,
our revenue would actually be pretty high. And for our 3 layers that we're actually tackling, we're basically tackling all the layers relevant to our industry. When it comes to actually end users or people that are getting into collision, that's not something that we're targeting right now, because it's not a environment that we're actually basically targeting, because it doesn't involve the manufacturer, the jobber, and the body shop. Something that best is collision supplies. So we really want to start with what we know best and make our experience really great for our users before we get into, say, like parts, where 50% is a return rate, and we have all kinds of other headaches that we now have to take into consideration. So we really want to own what we do and be the best at what we do and gain that market share, and then introduce new add-ons like you see with these tech companies. Increase the sale, they increase the value of our manufacturer advertisements to increase the revenue as well.
Guys, I have to cut you off. That's 10 minutes of Q&A. It was an outstanding presentation. Thank you very much. So unshare your screen, please, and you can leave us now. The judges are going to spend a few minutes judging. Melanie, I think we can release the audience, except to say that we're going to do this all over again tomorrow night. So please tune in and join us to see 5 more companies pitch tomorrow night with 5 more judges and me from my kitchen here in Toronto. So judges, you got 5 minutes. Do your thing. And Melanie, I think we can say goodnight to the attendees and to Taylor and Vinostics. Abrar, sorry.
It's all good, Jeff.
It's been a long day for me already.
Thank you, everyone. Appreciate your time.
Thank you, guys.
Yeah, well
Thank
done,
you.
guys. Thank you.
Bye.
Jeff, do you want the deliberation to be recorded? You're muted.
No, I don't think we need to record it. Thank you. So we still have